Homeless Youth in America, A Cultural Analysis to Help Build Counseling Competence by Alexandra Montalvo. I want us to start by taking time to look at these photos. What thoughts and feelings come to mind when you see these photos? The contents discussed include the following: a brief history, societal factors, consequences, counseling homeless youth, potential issues, ethical and social justice, advocacy. A brief history, homelessness in America on the rise. The idea of homelessness in America can date back to colonial times. However, we're going to focus on more modern history. The word homelessness emerged in 1870s due to the growing industrialization that caused migration to urban centers. During this time, the idea of homelessness was focused on the loss of character and a perceived emerging moral crisis that threatened long-held ideas of home life. In the 1880s, this idea softened as culture of the migrant laborers was often romanticized in American literature. However, by the 1920s, that soon faded as companies began to value loyalty and longevity. By the 1980s, the emergence of what now may be considered the modern area of homelessness emerged. We will define youth homelessness as individuals who lack a fixed, regular, and adequate nighttime residence, including children and youths who are sharing the housing of others due to loss of housing, economic hardship, or a similar reason, are living in motels, hotels, trailer parks, or camping grounds due to the lack of alternative adequate accommodations, are living in emergency or transitional shelters, are abandoned in hospitals, or are awaiting foster care placement, children and youths who have a primary nighttime residence that is a public or private place not designed for and ordinarily used as a regular sleeping accommodation for human beings, children and youths who are living in cars, parks, public spaces, abandoned buildings, substandard housing, bus or train stations, or similar settings, migratory children who qualify as homeless for the purpose of the subtitle because the children are living in circumstances described in clauses 1 through 3. Societal factors, possible causes of childhood homelessness. Factors that contribute to childhood homelessness are both structural and individual. 1. The nation's persistently high rates of poverty for families. 2. A lack of affordable housing across the nation. 3. Continuing impacts of the Great Recession. 4. Racial disparities in homelessness. 5. The challenge of single parenting. 6. The ways in which traumatic experiences, especially domestic violence, precede and prolong homelessness for families. Please take time to review more information about each of the following structural or individual factors that contribute to homelessness. More factors that contribute to childhood homelessness include being a minority, such as being Hispanic or Black, parenting and being unmarried, a youth's sexual orientation, LGBTQ and LGBTQ youth, family conflict and family dynamics, sexual activity, school problems, pregnancy, substance use, children in foster care, and basic human development. A study by the Voices of Youth Count from Chapin Hall at the University of Chicago found the following: 29% of homeless youth are struggling with substance misuse problems. 69% of homeless youth have mental health problems. 33% had once been part of a foster care system. 50% of homeless youth have been in the juvenile justice system in jail or detention. 27% of lesbian, gay, bisexual, transgender, queer, and questioning youth are homeless, reported exchanging sex for basic needs. 62% of LGBTQ youth report being physically harmed while experiencing homelessness, while 47% of non-LGBTQ youth reported being physically harmed while homeless. The lack of a high school diploma or GED increases the risk for youth homelessness. Consequences: the potential risks faced by homeless youth. The consequences faced by youth experiencing homelessness are vast and require coordination across the education, child welfare, juvenile justice, health, and human services systems. As you can see, homeless youth are vulnerable to multiple threats: not having their basic food and shelter needs met, untreated mental health disorders, substance use, sexually transmitted diseases and HIV infection, sexual exploitation, including survival sex to meet basic needs, and physical victimization and suicide. According to the National Sexual Violence Resource Center, 1 in 3 teens on the street will be lured into prostitution within 48 hours of leaving home. The American Academy of Pediatrics finds suicide the leading cause of death among unaccompanied youth. And a significant disruption in their education is due to the transient nature of homelessness. Counseling homeless youth, building cultural competence. To end their homelessness, youth and young adults need stable housing, supportive connections to caring adults, and access to mainstream services that will place them on a path to long-term success. As a counselor that is working with homeless youth, one needs to be aware of appropriate interventions to use both with youth and homeless demographics. It's important to practice by embracing the multicultural counseling and social justice competencies. Know the limits of confidentiality. Know developmental theory. Use appropriate counseling skills. Use alternative modes of communication. Don't lead the child. Know relevant laws. Know available resources, and practice appropriate closure. Counselors today need to know how to work with clients who may be dependent or addicted to substances. A new study comparing 27 other studies of drug use in homeless children indicates that a homeless child is 60% more likely to use drugs in his or her lifetime compared to a non-homeless child. When working with homeless youth, barriers will arise due to unrealistic expectations about youth's behavior, legal issues such as the lack of parental permission, lack of documentation and identification, and the criminalization of status offenses or behaviors which are only illegal when done by a minor. Youth perception of the availability of services and trustworthiness of service providers and adults in general. The youth knowledge of available services, particularly when networks of services are complicated or difficult to assess or understand. Insufficient agency resources for creating and maintaining safe spaces for youth. These resource limitations may be particularly challenging in rural and sparsely populated areas. Ethical and social justice for homeless youth. States have adopted a variety of policies to combat youth homelessness. Some policies address the educational needs of homelessness and runaway youth, while others appropriate money for shelters and transitional housing. Other policies include counseling and outreach services to homeless youth or youth at risk of becoming homeless. An abbreviated timeline of federal homeless youth policies. The 1912 Runaway Youth Act, created by the Children's Bureau, established to investigate and report on all matters related to children's welfare. 1974 Runaway Youth Act, as the Title III of the Juvenile Justice and Delinquency Prevention Act, is enacted. The legislation establishes what is now referred to as the Basic Center Program. 1977 Congress and the President reauthorized the Runaway Act and broadened its scope to include otherwise homeless youth. The McKinney-Vento Homeless Assistance Act of 1987 was the first major federal legislative response to homelessness. Title VII of the Act includes provisions to ensure the enrollment, attendance, and success of homeless children and youth in school. 1999, the Runaway and Homeless Youth Act is reauthorized. 2015, Runaway and Homeless Youth Program grantees begin reporting demographic and outcome data on program participants to the Homeless Management Information System, also known as the HMIS. Advocacy for homeless youth takes many shapes and forms. However, it is important to remember that advocacy at the professional level includes the following. Self-care. Engaging in advocacy work can be inspiring as well as exhausting. It is important for counselors and counselor trainees to build up supportive networks, resources, and self-care practices if they wish to engage in effective and sustained advocacy efforts. Integrated services. Pilot studies of programs that employ interagency collaboration and training and that include consumers in program design have demonstrated significant improvements in treatment outcomes. Counselor training. Encourage greater inclusiveness of class issue and counselor training and education. Research. Participate in or initiate research that moves away from defining poverty as an individual problem by examining social perceptions and social political structures that perpetuate poverty. Attend to basic needs. The most effective form of preventing major mental illness is attending to the impact of economic stressors, such as unemployment, housing instability, and homelessness. Empowerment. Work with and for economically marginalized communities to promote mental health, assertiveness, and general empowerment. Education and training. Training areas that may be most relevant to economically marginalized communities and youth. Public policy. Contact local, state, and regional professional organizations for counselors and ask about past, current, and pending advocacy efforts related. Universal health insurance. Join the effort to ensure access to quality health care for everyone. This concludes our presentation on youth homelessness in the United States. Again, I want you to take some time to look at the pictures. What thoughts and feelings come to mind when you see these photos?